First, we will be seeing about the axilla and the pectoral gird muscles. The first muscle which we know is the pectoralis major muscle. And one question which is often asked is the type of the muscle fibers present in pectoralis major, that is the spiral muscles. So it starts from the sternum and the clavicle, and then which is a broad origin, but it gets inverted into the lateral lip of the bicipital groove, which is a narrow insertion, because this is because of the spiral nature of the pectoralis major muscle. So the next muscle is the deltoid. So between this pectoralis muscle and deltoid, there lies the deltopectoral groove. So we will be seeing about the contents of the deltopectoral groove. Those are the cephalic vein and the deltoid branch of the thoracoacromion artery. So first we saw pectoralis major, deltoid, in the deltopectoral groove and its contents. Next, we will move on to the transverse section of the axilla. So this is the anterior part, this is the posterior part. Next, we will be moving on to the transverse section of the axilla. Although this image might look complicated to you, let us dissect it and understand each part of it one by one. So the most prominent structure in this image is the humerus. After identifying the humerus, we will identify the sides. This is the medial side and that is the lateral side. So in the medial side, we are having the chest, ribs, etc. And lateral to it is to the humerus is the lateral side. Then we will be identifying the anterior and the posterior side. To identify it easily, I will give you a hint, that is the anterior axillary fold is thinner, whereas the posterior axillary fold is thicker. So wherever you are seeing the thinner side, that is the anterior, and wherever you are seeing the thicker, that is the posterior. So in the anterior axillary fold, we are having pectoralis major and pectoralis minor. Pectoralis minor lies behind pectoralis major. Next, we are seeing about the posterior axillary fold. There lies the subscapularis muscle, which is the major muscle which lies behind the scapula. Since this is a section which is taken just beneath the spinous process of the scapula, we can appreciate the infraspinatus muscle also here. So on the medial side, we have the serratus anterior muscle, which lies between the ribs from the first to the eighth ribs. And on the lateral side of the axilla, we have the humerus. So in the anterior side, we will be having pectoralis major and pectoralis minor. In the posterior, we have the subscapularis. In the medial side, we have the serratus anterior, and lateral to it, we have the humerus. So this axilla consists of axillary vessels and cords of brachial plexus, which we cannot appreciate in this section much. We will be further dissecting into in the further sections. So let me be clear with this section: pectoralis major, pectoralis minor, subscapularis, serratus anterior, humerus, and the contents, axillary vessels, and the cords of brachial plexus. Next, we will be moving to the most important and most frequently asked images, especially in AIMS exam, that is the brachial plexus. So the brachial plexus originates between the scalenus anterior and the scalenus medius. Before moving upon the roots, trunks, divisions, and the cords, we are seeing one nerve that is descending at the level of the origination of the brachial plexus, that is the phrenic nerve. Next, we will be seeing upon the roots of the brachial plexus. It starts with C5, C6, C7, C8, and T1. So the brachial plexus, which consists of the roots from C5 to T1, these are the roots These roots form the trunks, that is C5 and C6 combine to form the upper trunk. C7 will remain as it is and forms the middle trunk, whereas C8 and T1 forms the lower trunk. As we see in this picture, upper trunk, middle trunk and lower trunk. Before we move on to the divisions and the chords, we will be seeing one now which originates directly from the roots, that is C5, C6 and C7 combinedly gives rise to this long thoracic nerve. So these trunks will divide to form divisions and they will once again form the chords. So these chords are identified generally in relation to the axillary artery which will usually lie here. So to the axillary artery, this is lateral. So this is lateral cord. To the axillary artery, this is posterior. So this is posterior cord. To the axillary artery, this is medial. So it is medial cord. So we have lateral cord, posterior cord and medial cord. To understand the branches of the cords, we will just mark the demarcations of each cord. So these blue in color will form the lateral cord. The thing that is red in color will form the posterior cord, and the thing that is orange in color will form the medial cord. I think I should have put some other color so that there is no differentiation between orange and red. Okay, let us see the branches of the lateral cord. That is usually remembered by the mnemonic as LML. We will see the branches. So this blue in color is the lateral cord. First is the median nerve. So the lateral root of the median nerve comes from the lateral cord and the medial root of the medial nerve comes from the medial cord. So this is our median nerve. So the lateral root of the median nerve comes from the lateral cord. Next is our lateral pectoral nerve, which originates from the lateral cord and gives rise to a branch to the pectoralis minor, and it in turn pierces and gives ice branches to the pectoralis major. So this is lateral pectoral nerve. First is lateral root of median nerve, second is lateral pectoral nerve. The next branch is musculocutaneous nerve. It is the most important branch of the lateral cord. It directly goes and then pierces the coracobrachialis, then lies between the biceps and the brachialis, then it supplies its further branches. So we have the divisions of lateral cord, that is lateral root of median nerve, musculocutaneous nerve and lateral pectoral nerve. Then we will be moving on to posterior cord. In posterior cord, there are many branches which is usually remembered by the mnemonic ulnar. But we should also be careful to not forget that ulnar nerve is not a branch of posterior cord. So what are the branches of posterior cord? First is upper scapular nerve. So this upper scapular nerve goes and supplies the scapularis muscle. Next is lower scapular nerve. This lower scapular nerve goes and supplies our subscapularis muscle in the lower part and also the teres major muscle. So next we have nerve to the latissimus dorsi. This is the longest nerve which goes and supplies the latissimus dorsi. So these three muscles, subscapularis, teres major and latissimus dorsi, are supplied by the posterior cord of the brachial plexus. So these two nerves are remaining. The one that is entering the quadrangular space is the axillary nerve, and the another nerve which goes directly and supplies the radial area is the radial nerve. So these are the branches of our posterior cord. One is upper scapular nerve, another is lower scapular nerve, next is nerve to latissimus dorsi, next is axillary nerve and radial nerve, usually remembered by the mnemonic ulnar. The last one is medial cord. As we all know, the median root of the median nerve is given by the medial cord, and then the only nerve that is remaining is ulnar nerve. So let us revise. Our lateral cord gave rise to our lateral root of the median nerve, lateral pectoral nerve, and musculocutaneous nerve. The posterior cord gives rise to the ulnar branches, that is upper scapular nerve, lower scapular nerve, nerve to latissimus dorsi, axillary nerve, and radial nerve. And our medial cord, although it has many branches, the one that is evident here and that can be asked in exam too as a part is median root of medial nerve and ulnar nerve.